Hello, everybody. This is Monica Heltz with your daily Fishers Health Department update for August 12th. So a couple of things today. One, on our testing site, last time I mentioned that we were having the 10-day turnaround. We are still having some results that are delayed a little bit, but we have seen a ton of progress from the lab. The lab has been processing results very rapidly. And I think that we've managed to call out to any kind of positive results that we've received. We'll be cross-checking all the lists as they continue to come in. We are having some data issues this week with receiving those results through our system and getting them out to you. So we are troubleshooting that aggressively today. And if it means that we call each and every one of you, that's what we're planning to do. So just please be patient with that. We hope to get you your results as soon as possible, but we have seen a lot of improvement from the lab standpoint. We're also continuing to work on increasing our lab network. There's some different systems that the State Department of Health is putting in place to support local health departments that we'll be working through. So all of that continues to be in the works. I wanted to mention schools for a minute. The HSE board is meeting tonight. I will plan to be in attendance, and I will keep you updated as soon as I know how much that might or might not affect public health. And in this pandemic, I don't know what they're planning to do at this particular moment in time. So I will, again, talk about this probably on tomorrow's video as well. From our end, we are doing a lot to try to make sure to support the schools on the back end. We are getting a number of contact tracers in place to support any kind of massive call downs that we may or may not need to do. And fully support any kind of efforts that the schools make and just be ready to go. We know that some of our private schools in the area have gone back or will be going back very shortly. We've continued to be in good communication with them as well. We continue to have a lot of situations on our athletic teams. Most of the exposures do not appear to be happening while kids are practicing, but rather in family groups and from outside exposures. So continue to use caution in your interactions with your friends and your family. I would continue to urge paying attention to the guidelines. The State Department of Health, the Hamilton County Health Department, the Fishers Health Department, we're all using the same guidelines that come down from the CDC. If you are exposed to someone who has COVID and you've been within 6 feet of that person for more than 15 minutes, or you live in their same household, you really need to be quarantining. And you need to quarantine for 2 solid weeks. So please pay attention to this guideline. If you have COVID, if you've been confirmed to have it, you're going to need to be on isolation for at least 10 days. And that 10 days starts from when your symptoms start. If you don't have any symptoms, it starts from the day that you got tested. And those last 24 hours of your 10 days, you've got to be fever free and your symptoms need to be improving before you go back out into the community. So please, 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 listen to our guidelines. Don't show up and expose other people. We all want to get ahead of this. We all want to kind of find our way through this and be able to function. We don't want to shut everything down again, but we need everybody's support. We're all in this together. Please continue to use your mask when you're out and about. All of these things are working and they're helping, but we can't do them if only 50% of people follow them. And we have seen a lot of really good response from the mask mandate. A lot of people are out there wearing masks. We have, seen a lot of people really go into great trouble to try to make sure to follow the guidelines, and we so appreciate that. But just a reminder that it really takes all of us. We've all got to be on the same page on this to make this work. One other thing I wanted to bring up is our dashboard. Our dashboard, because we're having these data issues, it's not just from us. It's from our software. So the testing site dashboard, they have their highest level of executive team working on it. So we're not going to be able to update that dashboard until that's sorted through. And then our community-wide dashboard is also a little bit behind on the updating, and that is because the State Department of Health is also having data issues. So apparently this is the week for data problems. So I apologize about that. We will keep you updated. We'll, definitely update our dashboards as soon as we get appropriate information from the state and from our software provider. So thanks for your patience. No drastic changes at this point. I think the percent positivity rate remains the same, and so does the case rate is roughly the same, but we don't have the exact numbers quite yet. So we'll get that updated as soon as we have it, but no great changes to report today. Thank you so much. Bye.